Hello, everyone. A very good evening to all of you. I'm your host, Sayukta, and we are at All About Skin Wellbeing page. So I'm sure all of you must be doing really good. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in their lives. Urticaria is characterized by a round rash on the skin that itch a lot. It may be due to chemicals in certain food items, allergy to certain medication, insect stings, sunlight, and sometimes the cause is even unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can worsen the symptoms. Consult your nearby qualified skin specialist immediately for an early relief. As we all know, in today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of rest required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist, Dr. Priya K S, who is an MBBS MD. She has also done her FRJUHS in dermatosurgery from Bangalore. Dr. Priya practices at Derma Heal Center at Basaveshwar Nagar, Bangalore, which is a center for skin, hair, and lasers. She is also professor at Rajarajeshwari Medical College for 22 years. It's such a pleasure to have you with us, Dr. Priya. Very warm welcome to you.
Thank you, Sayukta, for the nice introduction. Good evening, all, and thank you, Vistas media team, for inviting me to give a talk on urticaria.
It's such an important topic, doctor, to discuss urticaria because it's quite common, and most of us is not aware about urticaria. So, doctor, to start with, what is urticaria?
Urticaria is something like, in a layman term, we can say it as a skin rash, which usually appears as pink to red in color, something, raised bump, I can say, above the skin surface. Okay. And it is also called as hives in layman term. And it can be of two types based on the duration, which can be acute or chronic. And basically, it is a itches condition. So acute is if the lesions are persisting for less than 2 weeks, it is called as acute. And if it goes beyond 6 weeks, then it is called as chronic urticaria. And maybe I think it affects 20% of the general population. And it can be of any size, from few millimeters to few centimeters. Maybe, it can take the shape of a pea or a coin, or it can be of a geographic borders also.
Okay, right. So this is all about urticaria. Now, doctor, what causes urticaria? Because it's quite common. So
Yes.
what are the factors responsible for it?
Acute, it can be of many types. It can be because of, food or infections. In under infections, you have so many causes. It could be bacteria, where you tend to have ear infections or tonsillitis or anything, and also viral infections, and also even COVID. Also, I think people were having this urticarial rashes, and along with that, herpes and fungal infections, and also there is something called as parasites, that is worm infestation. So usually before we start the treatment, we also give deworming agents for the patient.
Okay.
And also sometimes even what do you call as inhalations, could be chemicals or anything. And other than that, you have contact allergens. Okay. Or also it could be because of the bite of the insects or bee stings, anything. This comes under acute urticaria, as I said, within less than 6 weeks.
Right. And for chronic urticaria, what could be the probable factors responsible, doctor?
Yeah, chronic, sometimes it can be idiopathic, and actually it is very difficult to identify the agent. And under that, we have physical urticaria. It could be just with the pressure urticaria, where you tend to see the rashes under the fixed like strap or belt or watches that, or aquagenic when they come in contact with the water, or even the stress also. Stress, solar urticaria when they get exposed to the sunlight, and sometimes even cold when they try to drink cold water or any ice creams. That is also one of the reason. So we have many types under chronic urticaria. And sometimes we will not the reason we will not be able to know the reason also. That comes under as chronic idiopathic urticaria.
Okay. I mean, otherwise also the list is so long for
Yes.
various triggers. It can be from food, it can be from medicine, it can be from
Exactly. Yeah.
insects,
I forgot to
weather,
mention
pressure. Yeah, the list is very long. So anything under the sun, and even sun can cause urticaria.
definitely.
Okay. Now, doctor, a very common question people often ask is that is urticaria a serious condition, a serious disease? And if we keep it untreated, are there any potential complication that can, rise?
As I said, just urticaria may not be a serious complication, but it can be really depressing to the patient. Okay, because every time you tend to scratch, and he'll have a sleepless nights, and the quality of his life may be disturbed. Along with that, if the urticaria is associated with swelling of lips or tongue, throat, the patient will have difficulty in breathing or swallowing, or his voice might get changed. He'll have a hoarseness of voice. So all this can be an emergency case. Yeah, definitely.
Okay. So anyways, do not ignore in case you have urticaria. In case you have urticaria, whatever the trigger is, please go and consult the right person, which is a qualified dermatologist.
If
The
not a
problem is,
dermatologist, maybe they can visit a general physician at least, but they have to avoid the self-medication.
right. I was coming to that point, doctor, because it's such a common practice in our society because the chemist shops are so easily accessible, available, and a very common thing because we know it's some kind of allergy. We'll go to a nearby chemist shop and ask for some anti-allergens, and it do give relief for a few hours or
Temporarily.
maybe sometimes. So, and we feel that okay, we have found the relief, or else we'll buy something to apply on the lesions. We don't know as a common man, as a layman, that whether it's urticaria, how to deal with it, etc. That's why we are having such sessions. But then people are so ignorant many a times, and they'll just buy anything from over the counter and apply or have it in form of pills. So what's your advice on that? How bad it can go?
That's what, as I said, you can, self-medication, you can apply some moisturizer, or you get in the counter, in general, calamine lotion. That is safer. But other than that, oral medication has to be avoided. That's one more thing. But if they see any swelling of lips, then they have to contact the doctor immediately.
So if there is any kind of swelling on your
Swelling,
lips, tongues, etc.,
if they feel, because breathlessness or vomiting, nausea or diarrhea, even all these are emergency. I mean to say it is a warning sign.
And I think our, surroundings should also be aware in case we are allergic to something, because when we will have that condition, probably we are not in a state to tell someone that, see, I was allergic to a thing and maybe it got triggered and now you need to take me to a hospital. So even the surroundings should be aware, our family members, our colleagues, etc. In case we are allergic or we have a trigger point, at least they should be aware of, right, doctor?
Definitely. Definitely.
Okay. Now, coming to acute and chronic urticaria, you said these are the two broad categories, bifurcations that we can have for urticaria, and it's mostly on their duration. One is if it's less than 6 weeks, it's acute, more than 6 weeks, it's chronic. But how, in terms of treatment or in terms of the severity of urticaria, we can differentiate these two?
In acute urticaria, it is, I'm not saying very easy, but we can identify that triggering agent. So we will know the cause, because it would be very shortly, maybe few days back or something, we can identify the agent. And in chronic, because it goes beyond 6 weeks, it's very difficult to identify the agent. And as I said, it could be because anything, it may not be because of the food itself. It could be because of the other heredity also sometimes. So the treatment goes, and they also have to change the lifestyles, their diet, and everything.
Okay, right.
Acute, it is very easy to treat.
Because you know the
Yes,
triggering
we
factor.
can identify the agent most of the times.
Right. So it's important to find out what's causing urticaria. And if that cause is found, then it becomes even easier to treat because at least you know what is
Yeah.
triggering.
But as I said, angioedema, that is swelling of lips, can occur in acute urticaria.
Okay.
Because of that, as I said, it could be any of the inhalation of any chemicals or having anything like food, like seafood, it could be a fish or anything. Common. Yeah, they can go for an emergency. Otherwise, we can usually treat acute urticaria very easily.
Now, normally what happens, for example, I'm not, allergic to eggs. Suddenly I ate egg and I'm getting an allergy and, but I can see the lesions, fading away in few hours or maybe a day or two. And then I'll say, okay, maybe it was a spontaneous urticaria. Let's not go and consult a doctor. Maybe after a few weeks, again, when I'll have egg, I'll have those lesions. So the problem is, by the time I'll reach a doctor, probably I'll forgot what I ate or what was the major change which could have brought those lesions. So normally, do you recommend your patients to maintain a diary or something, or because recalling, it's just not about food, as you said, anything can trigger urticaria. So how can we recall it?
Definitely, we asked after extracting the history, we usually ask them to maintain a diary where they have, they are supposed to write what all they had. And after even the duration of what do you call it, the lesions, because it differs, right? So we usually ask them to maintain the dietary things in their book or something so that they will definitely identify the agent. I'm going to say, as I said, peanuts is one of the common cause, and fish, all these, even tomatoes, alcohol, all these. So it is better to maintain the dairy so that it'll be useful for them. So usually I ask them to have only one kind of food, because if they have everything together, it'll be difficult for them to identify the agent. So for some time, it is better they have one kind of dish so that it's easier for us.
Right. You also said, and we have also witnessed this during COVID, there was such a surge in the cases of hives or urticaria because season, is also changing. Weather is changing. Monsoon is there in most parts of India, and we are getting a lot of viral fever cases. Now, with viral or with UTI, also, many times we find these hives on our body. So, are they the same? Is it also urticaria?
Yes. Both are same. Urticaria, the other term is known as hives. So both are the same.
Right. So because they are so common with the, viral fever or with UTI, my question to you is, doctor, in case, because, this is the time when we get a lot of patients with viral fever or UTI, etc. What should we do? Because of course we are going and consulting a doctor for our fever or whatever problem is there with UTI, other infections. Do we also need to go and consult a dermat for those hives, or they'll just fade away once we are okay?
No, it is better to consult a doctor, because sometimes, as I said, one of the cause is also infection, which could be bacterial, as you said, UTI and all, upper respiratory tract infection. So it is better to consult a doctor and take the treatment. Definitely.
Okay.
Yeah.
So the bottom line remains, in case you have urticaria, please go and consult a doctor. Do not self-medicate. That's a big no-no. Now, doctor, many a times patients complain. You also said that patients will have sleepless nights. They many a times complain that during night, the itchiness, it increases, it worsens, the symptoms worsens. So, is there a correlationship, or what could be the probable reason for this exaggeration in
I
symptoms?
do not think that there is some correlation between the night aggravation, because maybe the patients would have been, usually they get busier in their work during the daytime, and evening they are more relaxed, and their concentration mainly goes to the
Yeah.
Yes.
Yes,
So
yeah.
it doesn't actually has any correlation with the day or night. No, I don't think so.
It's just that during the day you
Yeah,
are
they're
preoccupied. So
occupied
yeah.
with the work. Yeah.
Right. Many times patients also complain of getting fatigued, very tired. So is this because continuously they are, itching, etc., or they are on medication? What could be the reason,
Yeah,
doctor?
fatigue could be due to that's what because of the sleepless nights they can have tiresome, and also sometimes our medication also causes tiredness,
Mm-hmm.
which we give it for the patients. We call it, it comes under antihistamines, so it can cause drowsiness. So that can give rise to tiredness or dizziness. Yes, definitely.
And doctor, can urticaria be caused by stress or aggravated by stress?
Yes, stress is one of the causative agent. Urticaria can cause stress, and stress can cause, it's a vice versa, both.
Mm-hmm.
Right? Because if they keep getting urticarial rashes every day, they can, go under depression also. Sometimes we have seen patients going under depression.
We
So
can imagine that.
stress
Yeah.
can be both.
Right. And ultimately, it becomes a vicious circle,
Correct.
urticaria increasing
Yeah,
your stress, stress increasing urticaria, etc., etc. So, to break that, again, you need to go and consult a doctor.
consult
So,
the
the
doctor.
bottom line remains the same in
Yeah,
case you have urticaria.
exactly. And along with that, they can go for meditation for stress. I'm saying, other than
Hmm.
our medication, they at home they can just practice yoga or meditation. Yeah,
Hmm.
they can undergo these things.
And especially people who have chronic urticaria, they often ask that, will it permanently go away or, I'll get completely cure with this. So, what's your say to that, doctor?
It depends on each individuals. I will not say also that it will completely go or it will be, it depends. First thing is, as I said, they have to identify the agent. And if they follow all that, maybe I think they can prevent or it can be reduced.
Hmm.
So if
Right.
they know that it is because of solar, because of the sun, if they avoid, I think probably it'll be reduced. So they have to mainly concentrate on the positive triggering factors.
Hmm. Right. Of course. So if you know the triggering factor,
Factors.
you can avoid it. So
You
of
can avoid
course
it.
that will help you.
And there are medication as such, but still you cannot predict that. You cannot assure, people that, okay, if you take this, it's completely no. You cannot say that.
Mhm. But at least we can control the situation, right?
Definitely, yes. It is something like, you have to be on medication for some time. It is
Hmm.
not like immediately when we give the medication within few weeks, it disappears. No, it can go from few months to few years also. They might have to take the medication as diabetes or hypertensive.
Hmm.
So you cannot just say that
Hmm.
it is
So
permanent cure.
overnight, it's not going to
No,
vanish
it is not
overnight, or
possible.
you're not going to get cured overnight. But yes, of course, it will, control the symptoms. It will
Symptoms,
give you some relief. And of course, you need to continue with the treatment
treatment,
and be in
medication.
touch with the doctor. That's really
Yeah.
important. Now, because we are talking about this, medicine part, many times what happens, again, a very common tradition in our society and tendency that, for example, I'm your patient. You have given me a medication of, say, 6 months for urticaria, for chronic urticaria. I'll follow it for maybe 1 month, 1.5 month. And as soon as I realizes that, okay, now I'm, getting relief, I will stop the medication all by myself, not with, even with consulting the doctor, nothing. I won't keep the doctor in the loop. I'll just stop
Okay.
it. Again, maybe after 3 months, I'll start having these arterial lesions. I'll go buy the medicines because I have the prescription with me and start it all over again. So, keeping the doctor in loop or consulting with your doctor is not a very, common thing that we see. So what's your take on that? Is it, I mean, we can do that, just, stop medication all by ourselves in case we have got relief from urticaria?
No, definitely not. It is better to consult a doctor again, otherwise I might have had to ask them to restart it again,
Okay.
right? Because
Uh,
even in case of antibiotics, we give the medication and if they stop all of a sudden in between, the infection get resistant to the particular drug. So it
hmm.
is always better to consult a doctor and then stop it. Unless and until then, it's no, you cannot stop it on your own.
Otherwise, anyways, we are seeing a lot of cases of
Yeah,
resistant, against
yeah,
antibacterial things or
definitely.
anti-fungal stuff. So
No,
yeah, it's
we do
important.
get cases like, as you said, yeah, people sometimes they stop all of a sudden and then again they come back. It's a very good question, actually.
Right. So it's not a good practice. Viewers, in case you are under treatment, trust your doctor. As we all said, that going to the doctor is important, going to the person who's, the expert of that particular problem, which in this case is, of course, a qualified dermatologist.
Apologies.
B, trust your doctor. Follow what the doctor has asked you to do. That's really important. Keep the doctor in loop. At least nowadays, it's so easy because, over
You
phone,
have a
online,
phone,
etc.
WhatsApp, yes.
Doctor is easily accessible. Doctor, any dietary precautions that we need to follow? Any do's and don'ts for patients of urticaria when it comes to diet?
Diet, as I said, yeah, they have to avoid, histamine content diets, actually, like, as I said, the sea fish or anything or nuts. And also in case of, even the vegetables, tomatoes, I'm just saying few things,
Hmm.
but it has a big list. You have to avoid those.
Hmm.
Histamine rich diet, you have to avoid.
Hmm. Right.
And also the processed diet, I mean to say, like, the preservatives, added preservatives like the coloring agent or anything preservatives, uh pickles,
Hmm.
whatever, that has to be
Hmm.
avoided, and they have to have
Various kinds of
yes,
sauces
sauces,
that is used in so
exactly.
many street foods like Chinese, etc. And it's quite common, people who are eat a lot of street food. Many a times they fall sick, and many a times they get urticaria just by those heavy colors or chemicals, whatever is there in.
Yeah, they have to avoid those
Hmm. Right. So avoiding these preservatives or the
preservatives.
that the doctor had just said is, of course, a
Yes.
good idea. Many times people will ask, is urticaria contagious? Can I get it from another patient of urticaria?
No, definitely it is not contagious. It definitely not transfer from one person to the other person. No.
Mm. Okay. Now, doctor, when a patient comes to you with urticaria, probably the patient don't even know what is happening on his or her skin as urticaria. Now, are there any tests that you normally recommend for, finding out what could be the root cause, etc.? Just by clinical investigation, taking history, etc., you're sure that, okay, this might be the reason.
Uh, One is, yeah, history. We have to definitely take the proper history. One is with that. And also, as I said, we do some tests called as, whether it is blanchable or not. When we press on the lesion, if the redness disappears, it goes more in favor of urticaria. Whenever you press your thumb or anything on the lesion, if it disappears, and when you take out your hand, if it again fills up, if the redness is, then you can call it as urticaria. But
Mm.
when you press it, if that redness doesn't disappear, then we can think of other skin issues.
Okay.
That is the clinical part.
Hmm.
And along with that, we usually get the blood test, routine blood test done. And there are also few tests specific for urticarias.
Okay. Now, because there's so much of information on various social media platforms these days. We have various influencers, then we have our good old home remedies, etc. Information is there. I mean, we are flooded with information, and a very common trending thing these days is to get a allergy test done. Again, we don't even consult with the doctor. We'll go straight into the lab, get the allergy test done, and then go to the doctor that, see, I'm allergic to these 20 food items and I've stopped eating these 20 food items and I'm still getting urticaria. So my point is, doctor, do you recommend these? I mean, you think it's okay to do practice to go for these allergy tests all by, ourselves, not without consulting the doctor?
Not really, because you do not know whether it is urticaria or something else. Because
Hmm.
similar kind of lesions we might get in other skin disease. It is
Hmm.
not just urticaria. It mimics, actually. It'll be almost similar. So it is always better to visit a dermatologist and then go for the lab test, whichever they say.
Hmm.
Right.
Right.
Because sometimes these urticaria, even due to drugs also, And there are other skin conditions which can
Mm.
mimic urticaria. So it is better to visit, I
A
think.
doctor,
Yeah,
right. And anyways, urticaria can be caused by so many, even if it's urticaria, there are so many causes or factors,
correct.
that are responsible. So just don't blame your food, don't blame your thali, and just by yourself, don't omit all the things from your thali just on the basis of a allergy test that you have done, which is not recommended by a doctor. Go to the doctor and trust your doctor. That's really important. I'm getting so many questions by various viewers. I'll take them one by one. Pooja Sharma is here. Her question is, can urticaria be linked to digestive issues?
Definitely. Sometimes it can, yeah. Because of the infection, GI infection, they can have urticaria.
Okay. Keelan Singh is here and his question is, can urticaria be triggered by dental procedures?
Definitely, because the metals which they use in dental, right? It may be, yeah, they can. They can have.
Okay.
Some people are allergic to that.
And as we discussed initially, anything under the sun and even the sun can cause urticaria. So I'm sure, yeah, anything can cause urticaria.
Yeah.
But the important thing remains that you need to go and consult a doctor
Doctor.
so that A, you find out whether it's urticaria or something else. B, what could be the probable cause. C, the treatment, etc. Um, Firoz Khan, his question is, can urticaria be a side effect of chemotherapy?
Chemotherapy, I'm not very sure, but I do not think so.
Hmm.
I
Uh,
would say some drugs can cause,
uh,
but chemotherapy, yeah, I've
yeah.
not come across any patient with that history.
But Feroz, in case you have doubt, you can definitely consult the oncologist who has, asked you to go for the chemo, or whoever is having, lesions after chemo. You can talk to your doctor or else consult a dermatologist.
Yeah.
That's the best.
Maybe if they are immunocompromised, I think then, yeah, probably they can. If they're because of the cancer drugs, anti-cancer drugs,
Hmm.
their immune system, even the disease itself, I think
Hmm.
maybe, yeah.
Then there are other, I mean, cancer patients are definitely, their immunity is,
Yeah, it comes down,
yeah.
so they can have.
Plus people who are, who are highly diabetic or who have huge thyroid disorders, etc. They are equally at the
Risk,
risk.
especially thyroid, because it's considered as one of the autoimmune disorder. Yeah, they are also at risk.
Hmm. Sona Sharma is here and her question is, can urticaria cause muscle pain?
Sometimes, yeah, they can. There is some condition called as urticarial vasculitis. Okay,
Okay.
this is something like a different entity. Here, along with the articular rashes, they can have tenderness. Along with that, they can have arthritis, again, abdominal pain. Yes.
So yeah, uh, urticaria may cause muscle pain, but
Yeah.
again, Sona, in case you have urticaria, even if it's causing muscle pain or not, the
Yeah.
important thing remains that you need to go and consult a
That's the
doctor.
doctor.
There's no point in suffering in silence because urticaria, as we were talking throughout, that it is such an annoying situation. You are continuously itching, scratching the lesions, and it's not a very comfortable thing for you. Many times people don't go for public functions, they stop doing socializing, etc., because they have this feeling that it's such an embarrassing situation to keep itching. Even in offices and colleges, we see the patients, they are so annoyed all the time. So other than the physical trauma that they are going through, it's also the
Mental trauma
mental
also, yeah.
trauma. And in case you want to, not let it hamper further the quality of your life, please go and consult a doctor. When a patient comes to your doctor, because as you said, many times patient goes in depression, it's such an embarrassing thing, annoying thing. Do you also, you also said that, doing yoga, doing something, meditation, etc. will help you. But do you also consult them for their mental peace and mental calmness?
Uh, Not really, but as I'm not a psychologist or something, but
Right.
counseling, I do counseling to them.
Mm. Because that's, I think, an
Yes,
equal,
that is
that
very
plays
much
an
needed
important
to them.
role.
As I said, the whole thing will, the quality of life is disturbed.
Mm.
So some kind of counseling will be done by me.
And I think as a family member, we can also play a very important role in taking our family member who's suffering so much to a doctor. So connecting them with the doctor and making them feel, that we are also, in a way, responsible and help them getting the
Yeah.
treatment complete is an important part.
I think family support is also needed to them, because every time they keep seeing the same symptoms, it's annoying for the patient's attender or family member. So we have to counsel the attenders also.
Right, it's equally important.
Yeah.
I have this question from Tina Bhargav, another viewer of ours, and her question is: can urticaria cause vision problem?
Vision problem, I've not come across with this vision problem. Dizziness and everything, yeah. But vision problem, no.
Ahana is here. How do you treat urticaria in infants?
Urticaria in infants. I've not seen any cases, any infants having this, but children, yes, I do see in case of children, but infants, not really.
And in case you have doubt, Ahana, because as doctors said many times, it's not urticaria, it might be something else. Maybe we are not, able to figure it out. Please go and consult the doctor, even if it's your pediatric, just go and consult with them. Akanksha is here. What all precautions I should take for my child who has urticaria at the age of 10 years?
Okay, have they visited the dermatologist, or because urticaria, that's what we should know, whether it is acute or chronic. One thing is that, and if it is chronic, again, we have to rule out many things. As I said, it could be anything, cold urticaria or heat urticaria. We have to rule out the triggering factors, and they have to avoid that.
Right. So, Kansha, if you have not yet consulted, please go and consult your doctor. And of course, try to find out the trigger point and then try to avoid the trigger point. Of course, the doctor will.
Yeah, sometimes it is also related with allergy related also. In that case, maybe they have to wait for some times, because again, asthma and all this urticaria are interrelated. So we have to find out the exact cause.
Right. And the potential complications is quite, big. So it's better to be
Get it treated
aware of.
as early as possible.
Right, right. So don't wait, just go consult your doctor. Doctor, one more time, because many a times what happens, people are, as we said, maybe urticaria is not a word with which people are very familiar with. Maybe they had urticaria, but they don't know whether it's urticaria or not. Another thing is, whatever happens on our skin, we take it quite lightly because we feel that on skin we can do n number of, experiments. We can apply this, not apply that, etc. So just for our sake, for our enlightening, if you can just tell us one more time how urticaria looks like, so that in case we have urticaria, we know, okay, this is urticaria and I need to rush and talk to a doctor without applying anything. I mean, for calming, it's okay, but not for any other purpose.
Okay. It appears as pink to red, raised bumps, I can say, raised lesion or raised bumps or edema associated with itchy. Okay. Either it will be just the red raised lesion, or else it can be like a ring. That's what we call it as wheals. And usually we tend to rub. We don't usually scratch the articulated lesions. Okay. Here we tend to rub to get the relief. So that is one more tips actually. And as I said, they have to just press on the lesion. If the redness disappears, then yeah, you can think of urticarial rashes.
Right. And Dr. Priya, before we sum up the whole session, any take-home message, anything that we have missed out on that you would like to say before we conclude?
One thing is, yeah, first thing is to avoid the food items which are rich in, as I said, histamine content. And also, please avoid self-medication. One is that. And if you have stress, again, deal with it, because don't go with that, because stress itself releases adrenaline and that can give rise to rashes. So one is that. And please avoid outside food, have home food, more of home food. I think that's it. This should
Right.
be enough.
Taking care of your body, taking care of yourselves is very important. And still, if you get urticaria, please go. Doctors are there to go to the right person,
Right
which is a
person.
doctor.
Yeah, but in case if they, along with that, if they have any swelling of lips or anything like that, that is an emergency.
Hmm.
So don't neglect.
Right, right. Thank you so very
Thank
much,
you.
Dr. Priya. It was wonderful talking to you. Thank you for this very informative
Thank you.
session.
Smita. Thank you.
Thank you. So now with your information, at least we know how to prevent ourselves and our near and dear ones from getting urticaria. And in case we get to see such lesions or symptoms, we need to go to a doctor rather than self-medication.
Medication. Yeah.
Right.
Thank you. Thank you, all the viewers.
Thank you, doctor. And viewers, thank you for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a great evening.
Thank you.